first of all, thank you for watching us. Today we are going to talk about tonsillitis. Tonsillitis was, requested for by a lady from Oman called Esther. Esther, we thank you first of all for watching us. And actually, this reminds me about applauding our consistent viewers and those that have taken a step forward. Someone seeks out for the subscription, and doesn't end there. Like the video, comment on the video, ask a question, interact, encourage. We thank you so much, people like Esther. Flavia, thank you so much. Flavia is another nurse working somewhere, but she's one of the very good person. Flavia, thank you so much. Dale, my brother Dale from Itiana. Florence and Nachibude, thank you for teaming up with us. Thank you so much, Jenny. Thank you so much, Joan. Alice Joy from Kenya. How is Kenya? Thank you so much. I always see your comments and then your questions. I hope we serve you pretty well. Thank you so much, Julian. You always comment, you always, you subscribe, you always comment, you always interact with us. People who go on every platform that we put over there. Thank you so much. Adera Bigo, our other nurse from Ginger. Thank you so much. Bridget Nakunda, my sister, thank you so much for subscribing. Big up on yourself. Ivan Mayambala, big up on yourself. Big up on yourself. Mama Katimbo. Thank you so much, Mama, for watching us, always for subscribing and the support. Thank you very much, very much. Yeah, so with that, allow me start on our topic today, or the reason as to why I'm here today to talk about or to talk to you. It is lunchtime here and we have a break, obviously, so I've come over here to talk about this because it was a request from our viewer. So, tonsillitis. Tonsils. First of all, let's understand tonsils. Tonsils are glands, and they are located at each side. There are two, one this side and the other one this side of the neck. These are glands that help us, to guard or to defend, their first line defense, you understand? Like when you eat anything that has any contaminations, any bacteria, any viruses, it is the tonsils, those glands that produce the white blood cells to fight that, virus or bacteria. So they guard mostly things that we take in by, chewing and all that stuff, maybe air. They help us. But this is what is funny, that even when they are defense, like even in practice, if you see army, an army is made to protect the nation. But if some intruders came in, they can either win the army or the army win them. So at some point, we have our tonsillitis, or rather our tonsils, worn by bacteria, by viruses, so they end up getting inflamed. But in most cases, that is a response by which they respond to an attack. There are so many other signs that we're gonna see, but that is what happens. And someone says, I have, they have difficult swallowing, painful. When they're swallowing, they really feel pain. They have sore throat, they have sore throat. At times they even have fever, when the body is trying to react to certain things, invasions. It tends to increase the metabolic rate and then producing, high kind of heat, and then the temperature of the whole body might go high. And pretty other signs when you come to the hospital, the healthcare center, we can assess, because it shares many signs with other infections. So it is normally when you come to the health center, that is when we can do certain things to rule out that this is tonsils or tonsillitis, or your tonsils have been attacked, but what is very important here, when we're diagnosing, the cardinal signs are sore throat and then very painful kind of swallowing, So that is it. But what do you got to do? What do you have to do when you're at home, to prevent? Prevention is, many cases, you've got to be able to take balanced diet, take a lot of fluids. You can pass a warm or cold, actually, depending, because when the tonsils have bulged and they are producing too much heat, you might need actually to pass a warm cloth around here. What is the essence? What is the essence of that? Is just to really help it to lose heat. Simple, only that. But there are two types. When it's caused by bacteria, in most cases it's streptococcal bacteria, and it is very complicated. The bacterial tonsillitis are very dangerous, more so when they are not treated. But there is a viral type. The viral type, in most cases, you just got to boost your immunity and then take water, too much water, and then it will go, it is the immunity that will help you to fight it. But don't forget that the defense system in the tonsils is strong one. In most cases, when we have too much stress and any other immunosuppressant kind of condition, you might be on cancer drugs, you might be having HIV and AIDS. This is the most times when you're vulnerable to such things, and when you are still young, when your immunity is young. At times they even call it a condition for young people, But when you are old, you have to take note that your immunity should be able to, fight any attack on the tonsils. But it doesn't actually exclude that, you can get them. So you don't have to say, oh, I'm old, I can't get them. You can get them. But in most vulnerable conditions, those are the most vulnerable conditions, when you have too much stress or when you're having any other immunosuppressant kind of condition you're going through. So when you come to the hospital, this is what we do. We diagnose, we diagnose such that we can confirm whether tonsillitis, and if tonsillitis, which type? Is it viral? Is it bacterial? When it is bacteria, we can give antibiotics for you to get well, We can add on some other treatments that will help you with pain relief and then anti-inflammatories, and then we can boost your immunity. That can be the regimen. We can give you the composition of the regimen of the treatment. If it is very serious, you can, in some cases, however, it is rare of late, but earlier, before these innovations of the many drugs came in, they used to do a surgery, what we call tonsillectomy. Tonsillectomy is just a surgery to remove the tonsillites, rather the tonsils, those organs, such that you don't have any other invasion again. But you lose that first line defense. That means you will be more susceptible to very many infections. They fight before whatever you ingest goes into your digestive system. So when you come, when it is viral, we can boost your immunity, we can work on to your pain, then your inflammation, such that you can swallow well, you know, you don't have dysphagia. So yeah, basically that is it. We encourage you to take too much water, yeah, and then we reassure you you'll get well, you know, the situation is in control. And then obviously it must get back to control. In most cases it takes something like 7 days, if not 10. But at times when you have very aggressive kind of treatment, it might be less than those days, you know. Most current treatments that we can give can really reduce that kind of time, such that you get well. But when we give you our pain relief anti-inflammatories, they can help you to, you know, kind of be back to normal. You swallow well, you don't get too much pain while swallowing, such that you don't, you know, starve. Because anything that tries to cut you from ingestion, from eating, from drinking, from, you know, taking in, it is predisposing you to very many other conditions. For example, if you have tonsillitis and then you spend very many days, like, you know, 3 or 4 not eating well, you know, you will get malnourished and you will be having other conditions. Your immunity will get low and many other infections will come in. Then you are not drinking, you know, you are not drinking because you have painful swallowing, you know. You can get dehydrated. You can see those are all complications, you know. And if left untreated, you know, it can disseminate. It can move away from only the tonsils and then it moves to other parts of the body, you know, because tonsils are connected to body system, tonsils are connected to lymphoid system, tonsils at some point, because even the lymphoid system is connected to the main blood stream, you know. So you can get what we call septicemia, and then very many other organs will get involved in that infection. So be vigilant. If you have anything like sores in your mouth, it is not normal for you. Sores in your throat, it is not good for you. Any difficulties in swallowing, you know, painful swallowing, you be vigilant. Just run to the health center that is near you. Some of the things we can't treat them at home, but we can, because if it's viral, for example, you just need to, if the pain is not really getting you off eating and drinking, then you just need to take too much water, and then your immunity will fight that virus, because they are simple kind of viruses that attack the tonsil, you know, and the body can control them, the immune system. But what is different with coming to the health center is that when you come to the health center, we talk to you and then we try to assess what would have been the problem. Why do you get them? You know, if you have any stresses, if you have any other condition that is putting down your immunity, we can look out for it, and then we reveal it to you so that you can know it, you know. You understand? So these things don't actually be recurrent, you know. Because at times it can become a recurrent kind of thing, and then it disturbs you very many or more frequently in a year or in a month, you know. It comes back, go, come, go, you know. At times it might turn into be a chronic one that it's not leaving, you know, things like that. But to me, coming to the health center is the best thing. Or if you have contact your nurse, your doctor, you can call them, or you can always call them and inquire, and they can direct you, and maybe they ask you a few questions such that they can, you know, get what can be the cause of this, you know. Yeah, so this is part of why we actually even created this YouTube channel, for you guys to come out every time whenever I feel any challenges. And when concerns came in that people need a closer kind of touch, we opened up other platforms. Please look out for our Facebook page. It is in the same names. It is BSc Nurse Solomoni Mpanga. Look out for it, like it. This YouTube channel is in the names of BSc Nurse Solomoni Mpanga. Please subscribe to it. You will have supported, first of all, us who present this information to you over here, but you will have supported some other people who will, you know, trust the channel because of the subscriber base. But you will have supported yourself as well, you know. Because we talk about every condition, and when you have any condition that you want to ask about, such that we serve you as well, just comment, you know. Go to our Facebook page, comment, send in an inbox, you know, a text to us. You can, our Facebook page has many posts about, you know, our WhatsApp group, our YouTube channel. You can just join our WhatsApp group. The link is there. Just click on the link and you will be joined automatically to our WhatsApp group. When you get onto our WhatsApp group, just post your question there and we shall be able to, you know, respond to it. And in most cases we do a video clip about it. But for you in particular, we just responded to it instantly by a text back, you know. Yeah, I want to talk about something. Yesterday we talked about another program that is coming in, because when we continue to serve you, we assess ourselves and we assess you, our viewers, and all people who follow us on our platforms, social media, website and YouTube, you know. We assess. So some people say they want you know, a more kind of touch, possibly to be specific. They want to be seeing us and us seeing them. Like they want us to be like as if in a session, but they are far away, and they want, you know, us in particular. Someone comes in and is like, I want Nurse Morris to talk to me, you know, I want Solomon, you know, talk to me, and yet they are very far. People who view us, some are in Oman, you know, very far away from here, and you can't really make it to be with us here to, you know, work on them physically, you know, and to have sessions with them physically. So we are trying to build up to come up with something better, but we started with Skype, you know. You just make arrangements with us and we can you know, have a session on Skype. We advise you on Skype, we counsel you on Skype, over on Skype, you know. We talk everything. We assess you on Skype, not physical assessment obviously, but you know, we can, you know, take your information and then we have a basis on which we can give you our advice such that it can help in your life. Yeah, so that one is already there. You just inbox us and tell us what you want to do or how you're gonna do it. We direct you, and you know, we said that one in particular, it will be costed by certain fees that we can agree upon, you and us, you know, when you know, show interest that you want that one in particular. However, our YouTube videos will remain free. Our information on YouTube will remain free. Our information in on our WhatsApp group will remain free. Our information on our Facebook page will remain free. Only physical sessions are charged. Only video sessions are charged. Possibly we are trying to do some changes on our you know, our website. Our website is as well in the names of BSc Nurse Solomoni Mpanga.com. We shall promote it later a little bit. We are still working with it to make it really a better one. So I want to thank you once again for viewing us. Thank you so much from wherever you are. I wish you nice lunch, you know, from me here. Thank you so much. Yeah, thank you, Florence Nachubude Sandra. I can see you there. Yeah, thank you, Esther. Thank you so much for watching us. Thank you, Flavia. Yeah, thank you. Our people out there very far. Our people from the USA. Our people from Oman, Arab Emirates, Qatar. Thank you so much. Our people from Kenya. Thank you so much. Our local people here in the community, you know, Uganda, Mukono, Luciana,